And welcome to the Dr. Bob Show. Have you ever wondered, will my allergies ever go away? You had spring allergies and you wait for them to go away, but then they persist and they go all year round. Why are allergies worse? Why do we have allergy symptoms all the time? Is it really allergy or is it pollution? Is it the bad air that we're breathing in? What is the cause of why I've always got nose problems? It's a question almost everybody in East Tennessee has. Hello, I'm Dr. Robert Overholt. My guest is Dr. Laura Green. Dr. Green is a board-certified allergist, and she'll be answering our questions on why allergies are so bad. Later on, I'll be talking about why is 90 minutes so important and in what illnesses is 90 minutes critical, and the nemesis of nosebleeds. Are you taking a medicine that may make it difficult for doctors not to stop nosebleeds? A lot of questions and answers for you. You'll want to stay tuned. We're talking with Dr. Laura Green, board-certified allergist, and we're talking about why are allergies so bad. Dr. Green, welcome to the Dr. Bob Show.
Hi, Dr. Bob. Thanks for having me.
It's so good to be here. Tell me, what's bothering people in the fall and the winter, or what's worse, spring or fall, allergies?
Well, as far as which one's worse, it really depends on what you're allergic to, because we have different pollens in the air in the spring typically than we do in the fall.
So what's in the spring?
Spring, we tend to see more trees and grasses.
And in the fall?
In the fall, we see more weed pollen.
So weed pollen. Name me a couple of weeds.
So we have ragweed. That's the big one. That's what is primarily in the air during
Are there
the
different
fall.
kinds of ragweed?
There are different kinds. There's northern, southern.
Does it float around all over the place?
It does, and what makes it especially difficult is that it travels for miles and miles. So even if you don't have it in your backyard, you're going to be exposed to it somewhere.
So one of these days it's going to get you. It used to be an old commercial. What other fall allergens are there in addition to weeds? What time of the year are weeds?
Weeds are usually more fall. We see ragweed start around the middle of August, and then it goes through the first hard frost.
So August, or middle of August, September, October, and November when it freezes. What does that do to the ragweed plant when it freezes, first frost?
First frost, it kills the plants and they're not able to release the pollen into the air.
So somebody says, whew, I'm free of allergies when the first frost comes in. Well, then what are the allergens that take over?
So we still have a lot of allergens present in the winter, and that's going to be things that are primarily in your home that you're exposed to. If you have pets, cats, dogs, their dander is going to be in the home, and we also have dust mites and molds that are problems.
Dust mites. Now, is that a little creature?
It is. They're tiny little mites. They live in your pillows, mattress, upholstered furniture, and you can't get rid of them.
Do people start itching when you tell them about that?
They do.
Well, let's go back to ragweed, the pollen that's in the fall. How does the reaction occur? When people breathe in ragweed pollen and there are 10 people, how many are going to probably have allergy problems?
Well, in this region, it seems like just about everybody. But when you breathe in the pollen, it goes up into your nose and it causes an immediate reaction for people that are allergic. So within the first 15 minutes or so, you're going to have itching, sneezing, runny nose, and it just really makes people feel miserable.
You know, at that time, we have people that are rubbing their nose and we call that the allergic sleep. What's worse, the nose or the eyes or the roof of the mouth? What's worse on that?
It's all bad. Most people complain about their nose giving them problems, but if you talk to people that have eye symptoms with their allergies, they're really miserable.
So do you have medicines that can treat all those?
Yes, of course we do.
So that's the immediate phase. That makes me think there may be a non-immediate phase.
There's a late phase that goes along with this. couple hours after your exposure, even as long as 4 to 8 hours later maybe, you have this late phase reaction where you get a lot of congestion. Your nose gets stuffy, you can't breathe through your nose, and you get a lot of drainage. And that's worse for a lot of people.
So why is that the stuffiness and congestion is their worst symptom? Because I always thought allergies were itching and sneezing. Being an allergist, I know a little different, but why is it that bothers people the most? Or
the biggest thing is that it really affects the way people rest. You can't sleep well if you can't breathe through your nose. You can't get into that really deep phase of sleep if you feel like you can't get air through your nose. So the less you sleep, the less rested you feel, and it just really makes you tired.
do people snore more with a stuffy nose?
They do, because if you can't breathe through your nose, you have to breathe through your mouth. And if you're breathing through your mouth, you're more likely to be snoring.
So what are the symptoms of that late phase reaction? Stuffy, congestion, and drainage.
And drainage.
Does that bother the eyes, or that's mainly the acute reaction?
The acute reaction also bothers the eyes. So people get itchy, watery, red eyes, and it really just feels like you want to scratch them.
So after ragweed's over, and we'll go back to the treatment in just a little bit. Now the ragweed bothers the nose, but when we breathe in stuff, it can also bother
the lungs.
Oh, so we can get, what's the lung disease that allergies can cause?
They can cause asthma.
And asthma is a condition where people are doing what?
Asthma, things that you're going to see in patients with asthma, they're going to complain of tightness in their chest. They're going to complain of coughing, maybe a dry cough, especially maybe at night. And they may have wheezing. They may actually hear themselves or feel themselves wheeze.
Cough, wheeze, shortness of breath, tightness in the chest. That must be very scary also.
It is.
So if you can't sleep, you can't breathe, you're in big trouble from allergies at that time of year.
That's right.
Later on in the winter, you mentioned dust mites. So let's talk about dust mites a little bit and why they're so important.
Dust mites are very important, especially in this part of the country. They're tiny little mites that live in upholstered furniture, mattresses, pillows. So that's going to be a big problem in our bedrooms. We spend about 1/3 of our day in our bedrooms, and you're just lying there exposed to this all night long. The little mites, there's millions of them in your mattress.
How many?
At least 10 million in your mattress.
How about the pillow?
At least 1 million in your pillow.
Wow, do they crawl around? Do they get up? Do they crawl on your skin?
You can't see them, so they're microscopic, but they do, what actually causes a lot of problems is they put out little fecal pellets, and each of the little mites puts out anywhere from up to 30 fecal pellets a day, and we breathe these things in, and for people who are allergic, that causes a problem.
Wow, so the pillows are loaded with dust mite fecal droplets, and so are the mattresses. So if you lay down on your pillow and you're not allergic, does that bother you?
If you're not allergic, it doesn't tend to cause as many problems.
If you lay down on your pillow and you breathe in, and you're allergic to dust and you breathe in dust mite droplets, what's that like?
It absolutely causes problems, and a lot of patients with dust mite allergy will notice a lot of morning symptoms. So they wake up in the morning with stuffy nose, and for patients with asthma, that might be the worst time for them, is when they go to sleep. They breathe this in and they wake up with coughing and wheezing.
So people really don't have a chance, it seems like.
It's hard.
Let's go back to ragweed. Let's go back to the fall pollen. How do we know if it's really that, or how do we know somebody has just got a cold?
There are some differences. Colds can cause sneezing and runny nose, but it tends to come on and be associated with other things that allergies aren't. So fevers are not typically associated with allergies. Body aches, not so much. And allergies will last longer. A cold will run its course over 7 to 10 days, and then you'll start to feel better.
And the allergy will last?
As long as your season.
So that could be 2.5 months, or it could be the whole year type situation.
Correct.
What is the treatment for ragweed hay fever or ragweed allergy in the fall? What's the treatment?
Big treatment is going to be to get someone on a nasal steroid spray. So that's going to be a cortisone spray that you spray in the nose. It will help, especially with the congestion. In addition to that, we have really good medicines over the counter now that are non-sedating antihistamines that people can take every day.
So we've got antihistamines and cortisone sprays. Now, what do the cortisone sprays do?
They work to help with the congestion. They help with inflammation. By reducing inflammation, people can breathe better. and it helps keep things opened up.
So I take it the late reactive phase is inflammation in the nose. It's causing, you said, the stuffy nose, the drainage, the blockhead, the miseries, I can't breathe, and the Flonase, the intranasal steroid, tells those cells and those symptoms to get out of there. Is there a key to how to use those intranasal steroids? What if you spray straight up? What's the problem?
Yes, so you want to have patients aim towards the top of the ear when they spray.
Why do you do that?
Because the nasal mucosa that we're trying to treat is more along this part of the nose. The septum, it has a lot of little blood vessels that are close to the surface, and if those get repeatedly treated with that steroid, it tends to cause nosebleeds.
So nosebleeds, you make sure you spray toward the outside. Your favorite cortisone spray?
One of the ones that most people are familiar with is Flonase or fluticasone spray.
Can you get those over the counter?
You can.
So they're good. You have to be careful with knowing how to use them?
You should know how to use it. Like I said, there are the side effects of nosebleeds, but in general, they're well tolerated.
So there are good medicines. You mentioned non-sedating antihistamines. What does that mean?
So we have some antihistamines like Benadryl, which work well to dry things up, but they have a lot of side effects with sedation. So the non-sedating or second generation antihistamines like Zyrtec, Allegra, Xyzal, those are all going to be better to use on a daily basis.
Dogs and cats, do they cause problems?
They sure do.
And that's what we're going to be talking about when we come back. Dogs, cats, mold, we'll go back to dust. Huge problems. Do they cause asthma also? How do you know it's really allergy? How do you know it's just not you got a bummer for a nose or a crooked nose? A lot of questions to be answered for you. You'll want to stay tuned. We're talking with Dr. Laura Green, board certified allergist. We've been talking about there's a difference between spring and fall allergies. Weeds are the main fall allergies. There's a sudden early phase where you get runny, itchy, sneezy, drives you crazy, and then a late phase reaction that causes the worst symptoms to the patient, which is stuffiness and congestion and drainage and blockhead, feeling poorly and can't sleep, and it really bothers people. We mentioned it could also cause asthma, and then we're going to talk about dogs, cats, and molds. So tell me about mold allergy. What is that, and doesn't everybody have it?
Not everybody has it, but some patients have allergies to the mold spores, and we see those in the air outside, but we also have it in homes.
So we have inside mold and outside mold?
Correct.
You said spores. What do you mean by a spore? How big is a spore?
It's very small. So mold spores can be as small as 2 microns in size, and that's very small.
That's big time small. So that's microscopic also.
It's microscopic.
So can you wave a glass with sticky glue on it and look under a microscope and find what mold looks like?
Yes.
And you can get mold counts.
Yes.
When is mold highest outside?
Outside, you're going to see higher mold counts when it's rained. So when the air is very humid, when you've had thunderstorms, you may see more mold in the air.
So mold count will be very high. And people at the end of ragweed season, what does rain do?
If for ragweed season, rain makes pollen allergies a little bit better.
So it washes the pollen out and then the mold's coming out and somebody thinks it must be confusing to patients.
It is.
So the mold symptoms, you said they're indoor molds. Where do you find those?
You can find them in the bedroom. A big place is you can see them in the bathroom. So if you have areas that are humid from where you've taken showers and there's not good ventilation, it sets up for mold growth. You'll see it in basements, crawl spaces, places that are warm, dark, and humid.
So mold likes warm, dark, humid places.
Correct.
They grow, you breathe them in. If you're allergic, you got big time trouble. Tell me about cats and dogs.
Cats and dogs are things that cause allergies for a lot of people, and we understand that pets are beloved members of the family, but they really can make asthma especially a lot worse and nasal symptoms worse.
So if we've got a dog in the bedroom or a cat in the bedroom, are there allergy-free cats and are there allergy-free dogs? Because most people think there are.
There are no truly hypoallergenic dogs or cats. There are dogs that shed less, and by shedding less, they put out less dander, which is usually what people are having a problem with, but they're not truly hypoallergenic.
So when it's the dander, it's the skin that gets on some of the fur that if they shed, you get it.
Correct.
And if they don't shed, you've still got dander. So which is worse in the bedroom, dog or cat?
Probably cat dander. Cat dander is incredibly sticky, and you can find cat dander on the walls of homes where there's never even been a cat living, just from being exposed to other people that have cats as pets. So it takes a lot longer for cat dander to get out of a room.
Can you find cat dander in a school?
Yes, you can.
Why?
Because lots of children have cats as pets.
And they bring their clothes to school and the cat dander there. So can you get enough cat dander in a school to cause sneezing in somebody that's sensitive?
You can, and especially in someone who's very sensitive, even just a little bit of cat dander is going to bother them.
So most people would rather get rid of their spouse than they would the beloved dog or cat. So how do you guide treatment in a bedroom where the dog and the cat are allowed in there and maybe even jump up on the bed and maybe even get on the foot of the bed or the head of the bed? What do you do with that?
The first thing, I would really try and talk with the patient about keeping the animals out of the bedroom if they can. Wash the bedding really well, keep the room vacuumed. It might be a good idea to consider getting a HEPA filter for the room that will help clean the air, but keeping the animals out of the bedroom is very important.
So that's the way we guide people, and if they can't, then we have to just vacuum a lot, change the bedding a lot, and get a room HEPA filter and hope that that gets enough of the dander out of the room where it won't make the person really, really sick. What are some of nighttime allergy symptoms?
Some nighttime allergy symptoms are going to be cough. People may have cough either from postnasal drainage from their nose, or if they have underlying asthma, they may have a dry cough that bothers them at night.
Is it common for people that are having asthma to wake up in the middle of the night with cough?
Yes, it's a common symptom of poorly controlled asthma to have a nighttime cough.
So you wake up in the middle of the night with coughing, you wake up in the middle of the night and you've got drainage, and the drainage causes cough. So allergies are really difficult on people. How did they recognize if they're allergic? What's skin testing like?
So we can do allergy skin testing, and we are able to get answers for a patient the same day of testing. We start with little scratches on the back using a little plastic scratch device that's been dipped in things that patients could be allergic to: pollens, molds, dust mites, cat, dog, and cockroach. We let those sit for about 15 minutes and then see if anything is red and itchy like a mosquito bite.
So if it's red and itchy like a mosquito bite, that would be
a positive result.
And so that could show up to either weeds, ragweed, or dust, or mold, or dogs, or cats.
Or all of the above.
Or all of the above. Is it frequently all the above?
A lot of people are sensitive to more than one thing.
So you've got a lot of things that are bothering people all winter long, and they really don't have a chance, but you can identify by skin testing. Is that
Yes.
the way the ball game that they're in? So how are you going to treat that?
So if patients have already tried medications and they still aren't able to optimize control of their symptoms, then we have allergy shots as a treatment option for them.
So what do?
Allergy shots work to desensitize patients over time or help them build up a tolerance to things that trigger their allergic symptoms.
Does it work for ragweed?
It does.
Do they work for certain molds?
Yes.
They work for dogs?
Yes.
Cats?
Yes.
So they really can be very, very effective.
They can be.
The allergy shots, do you have to get them regular?
You do, and I always tell patients it's a time commitment up front. In the beginning, we ask patients to come twice a week until they build up to a full strength treatment dose, and then it's once a week for at least a year, every 2 weeks usually for the second year, and then we can space out to every 3 weeks.
So what does the patient expect from results to the allergy shots?
They should expect good results over time. After the first year, they may notice about a 50% improvement in symptoms, closer to 80% improvement after the second year, and about 90% is expected or anticipated after the third year.
Sure, and everybody's different. If you've just got nose allergies, is there a chance you're going to get lung allergies, and does shots help from preventing that?
There is a chance, and we call it the allergic march.
What does that mean?
It means that you start with one body system that's affected and it tends to march along. We see kids who have eczema in childhood who then develop nasal allergies when they're a little bit older, and then they progress to asthma. And that's one of the big benefits of shots, is that they've been shown to either delay or stop the progression of asthma.
Anything else that can delay or stop it other than the allergy shots?
No, everything else is a Band-Aid, basically.
Yeah. So allergy shots are so important, and identifying what we're allergic is so important.
Correct.
And see somebody who's well trained like Dr. Laura Green. Laura, thank you. Dr. Green, thank you so much for coming to the Dr. Bob Show. You're a great, great teacher, and I've actually learned a lot from you tonight. Thanks for coming.
Thank you for having me.
Wow. You'll want to stay tuned. Later on, we'll be talking about what's so important about 90 minutes to getting to the doctor or the emergency room, and the nemesis of nosebleeds. A lot of information for you. You'll want to stay tuned. I want to thank Dr. Laura Green. Wonderful discussion on allergies, why they cause so much trouble in the fall and the winter. Thank you, Dr. Green. Wonderful discussion. And now, from you, the viewer, questions that I think will be important to your health. Question number one. Dr. Bob, what's so critical about getting to the emergency room if you think somebody's having a stroke? Well, if somebody's having a stroke, they've got garbled speech, they maybe can't move one of their limbs, one side of the face may be drawn. If we can get to the emergency room within 90 minutes, we can reestablish blood flow. In the emergency room, they'll decide if it's a clot causing the problem or if it's a hemorrhage, and the treatment is different with both of those. So if it's an ischemic stroke due to a clot or a blood vessel that's blocked off, they can actually give clot busters, and they can open up and reestablish blood flow. If they can do it quickly, then you may not have the residuals of a stroke. One thing new that's going on now, they go up through the arteries to the brain if it's identified that it's a thrombus, a stroke that's there due to a blood clot, and they can actually go up and grab that and pull it out of the blood vessel to reestablish flow. It's amazing what they can do with strokes. Other things that's important in 90 minutes, crushing chest pain. If you're having symptoms of a heart attack with crushing retrosternal chest pain radiating down the left arm or up into the jaw, or if you're a female and you're having sweating, shortness of breath, nausea, you know something's going on, your color turns pale, that's the time to go to the emergency room, and go to the emergency room quickly, because if you do and you're having a heart attack, they can reestablish blood flow. So know there's so much that we can do within that 90 minutes for people. Question number two, Dr. Bob. I've heard that there's a nemesis of nosebleeds. I was talking to an ear, nose, and throat doctor. Actually, what they said is now sometimes blood thinners keep a nosebleed from clotting. So if you've got a bad nosebleed, a gusher we call it, that won't stop, you have to go to the emergency room. In the emergency room, they call a specialist an ear, nose, and throat doctor. And in the past, they could pack or they can cauterize. But now with blood thinners, then the blood thinners, they can't stop the bleeding. So then the ear, nose, and throat doctor has to call up the heart doctor and say, hey, the blood thinner you've got this patient on, I can't stop the bleeding. We're going to have to stop that medicine. And then the heart doctor says, I can't stop that medicine. And so there's a big problem. No, my axiom is there is no free lunch. No matter what medicine you're taking, there is always a chance that you're going to have a side effect. Some medicines have nausea. Some medicines won't let the blood clot. Some medicines make us dizzy, make us lightheaded, make us nauseated. It will cause a rash. So there's no free lunch on any medicine. Know the medicines you're taking. Know how to discuss the side effects of your medicines with your doctor. That's all the time that we have for this show. Remember those three things that we always like. Number one, it's exercise. Think of what exercise can do for you. It reduces stress. It makes your heart stronger. It develops a substance that protects the lining of the heart so we won't have as many heart attacks that you may have had and not know it. And so exercise will lower our blood pressure. It helps us lose weight. It's a wonderful, it lets us sleep better. Number two, what do we like? It's eating properly. Be sure you're eating lots of fruits and lots of fiber. Why that? Because those are the ones that will help lower your cholesterol, which will block the vessels and cause medical problems. Fruits, vegetables, less red, fried, fatty foods. And when you eat meat or if you eat fish, try and select the ones that you know are going to be good for your health. 7.5 hours of sleep. Well, why is that important? Well, it's so important because you'll feel better, you'll rest better, the people around you will feel better, you'll be healthier. If we actually get 7.5 hours sleep, it really helps us even lose weight. So the benefits of 7.5 hours sleep are phenomenal. And last of all, and most of all, what do we like in the Dr. Bob Show? It's that laughter in your life. Remember, the more you laugh and giggle and are happy, the healthier you'll be.